Welcome to Health Cascades, a podcast from the University of Washington School of Public Health that explores how our health is decided and what we can do about it. Today, we're talking about how disease detectives are keeping people safe during the World Cup Games. Here in Seattle, the area is hosting 750,000 visitors from around the globe for World Cup matches. With this increase in people comes an increase in germs as we gather in restaurants, bars, or if we're lucky enough, stadiums to cheer on our teams. But this is why health departments have teams of epidemiologists who are closely monitoring the spread of infectious diseases like influenza and measles, and foodborne illnesses. That way, health departments can recognize if there are potential outbreaks, apply prevention measures, and minimize spread into our communities. Public health students at the University of Washington are helping with this disease detective work. These students are on the SEAL team, a competitive, intensive program in the Department of Epidemiology that trains graduate students on tracking communicable diseases and outbreak investigations. Two of those students are joining us today on Health Cascades: Maddie Ediger, master's student in the Department of Epidemiology, and Rahma Iqbal, master's student in the Department of Environmental and Occupational Health Sciences. Maddie and Rahma, welcome to the show.
Thanks so much.
Hi.
So you're both members of the SEAL team at the University of Washington School of Public Health, not to be confused with the Navy SEALs. Our SEAL team stands for Student Epidemic Action Leaders. What does the SEAL team do?
The SEAL team is a group of students across all departments in the School of Public Health, all graduate students, and we get matched up with local health jurisdictions or state health departments to do epidemiology projects.
Yeah, it's really cool because it's like taking what we are exposed to in our classes and it's all about applying it. What are the real world scenarios that health departments are working on today that are using those epidemiologic skills that we learn? How are we learning on the fly, which is like real job experience, and seeing what kinds of places in public health we also might want to go work in the future, which is really awesome.
So the current SEAL team field assignment focuses on disease surveillance due to the influx of people coming to Seattle for the World Cup. So can you describe to us what this work involves?
One of my absolute favorite tasks that we do, it's called syndromic surveillance. And to me, this feels like, when we were talking about epidemiologists being disease detectives, I'm like, this is it in real life. Syndromic surveillance is where we look at emergency department visits in King County that either have diagnoses that fall in line with notifiable conditions like measles or hepatitis or certain foodborne illnesses, or they have symptoms that could line up with this. And we look for those cases that aren't already in our system. It's kind of like that catch-all net that makes sure that we aren't missing any really important cases going around King County, that we can follow up on every case that's out there. And it's also a great one, thinking of the World Cup, to capture people coming in from out of state, because you're not going to have a primary care physician in King County. If you get sick, you're probably going to go to the emergency department, and we can capture that in our syndromic surveillance. And so that's been so much fun to learn how to do.
Yeah, Maddie and I are on the analytics and informatics team. And so each of us, the four of us SEALs that are focused on that, are also all doing individual projects that are primarily focused on data quality. So it's been also fun to get to work on the processes that really keep the health department services going and really maintain focus on cases and catching outbreaks, while working on processes that will continue to live on past our time with the health department as SEALs.
Could you describe what it looks like to track a disease outbreak during this time?
It can start in a few different ways, like thinking of foodborne illnesses in particular. There is what would you call it, like a website or a domain called FINS, where people can go and report like, hey, I ate at this restaurant and I got super sick. And then the other members of our SEAL team who are on the investigation side, they will look at those reports and they'll call people up and they'll be like, hey, tell me more. When did you start feeling sick? What were your symptoms? Where did you eat on that day? Where did you eat in the couple days before that? And what's really cool is you're able to find out in real time sometimes, oh, this might be considered an outbreak, because different diseases have different kind of metrics of what will qualify as an outbreak. For some people, it's a certain number in the same household even. And so, yeah, it's really cool, like watching our colleagues who are doing the calling be able to track throughout that pattern of, hey, people were eating at the same restaurant and reporting being sick, or in meetings across the entire team as people are talking about their own individual cases that they're calling, and you start to see a pattern emerge. It's really cool. One of the kind of back end ways we also do specifically like Shigella surveillance, Shigella, like that disease in particular, where we do genomic sequencing on it. And so just yesterday, we were going through the protocol and looking at cases that had recently been sequenced, where they can look at how similar one specific strain of Shigella is to other strains that have been identified in King County. And through that, based on how similar the genomes are, you can say, oh, these probably came from the same source. There are only like one or two differences between like the whole DNA sequence. And so just yesterday, we were able to like add a new one to the outbreak cluster. And you're like, oh, so you're helping to piece together the puzzle, which is really cool.
Yeah, the genomics work is super interesting, and it's really cool to see that in a health department setting. It seems like that's a newer thing and is really kind of still developing and in process. So that's been really fun to work with. For diseases other than foodborne diseases, a lot of the times those will be picked up through hospital or clinic records. Essentially, there is a list of notifiable conditions that have to be reported to the state. And so we get a lot of information from that as well. And it goes through the investigations process. And then the information that the investigations team or even the investigation SEALs collect is really helpful for our analytics and informatics work, and really ties into even future data quality work. You can really go back and see all the information they've collected, how detailed it is. It's super helpful.
So when a major event like the World Cup comes to town, why is it important to monitor for these diseases?
Well, it's important for protecting the public health of everyone in King County, not people only like who just live here, but also all of the visitors who are coming for the World Cup. When you have such a big influx of people, there's always a risk of just bacteria and pathogens spreading around, and you never really know exactly what's going to happen. But when you have health departments who are there in the background always doing this work, there's processes already set in place that are there to exist and catch these things before or while they're happening. And yeah, protecting the public health of Seattle is a good and noble goal, I think.
So you're gathering all this information. What is it then ultimately used for?
A lot of times it's used for public health recommendations. And so kind of continuing with foodborne illnesses, if we see that there's a specific restaurant where we can work with them on better cooling habits for their food or better cleaning processes. If we know that, there's an illness that's spreading through a daycare, we can help with sanitation practices through that daycare. And so it's really identifying spread of disease early on and then bringing resources together from the county to help cut it off quickly so that as few people as possible get sick. And especially with summertime coming around, it helps people enjoy their summer more. It keeps everyone healthy, keeps everyone safe, because we're able to bring together resources and make those recommendations.
Yeah, one of the great things about being focused on the prevention side of things is that just the way that we do investigations and the nature of calling cases individually and really talking to people. One of the benefits of this work also is that you're really connecting as a health department with people on a person-to-person level, which is really nice because public health is very focused on population data and thinking about populations as a whole. But because of the way that we do things, we still really get to do the person-to-person interaction. And I think that really makes a big difference in how public health practitioners think about their work.
Yeah, it's actually been really sweet seeing our counterparts who are doing the calling and just the amount of compassion that they have with working with individuals who are sick, may have been on the toilet for the last 2 days, who may be really frustrated. And the way that they help work through that frustration with people and also help give them answers, who help validate you telling us your story is going to help other people from getting sick. And so this is really valuable and we're grateful for your time. It's just really great, like you said, of getting that person-to-person interaction in a field that ultimately is working at the population level.
Yeah, that's really cool. You're able to have those interactions or hear your colleagues have those interactions and know that you can actually see the people being impacted and know you're kind of helping turn that around too. Is there a project or final report that you're expected to prepare for Public Health Seattle-King County at the end of this field assignment?
What's really great about this field assignment is this was able to double as my practicum for the School of Public Health.
Amazing.
So thank you, SEAL team. And what I'm working on for my practicum goes back to that genomic sequencing. I'm helping to develop a genomic sequencing monthly report that can go throughout our communicable disease team and talk about what new diseases we are capable of sequencing, what diseases have been sequenced in the past month. How many of those actually gave us information on clusters that were really similar, came from a similar source and helped us in the investigation process? It's really exciting to help develop this report and see, okay, how can we use this really exciting tool to its fullest extent? And also, how do you pull from all these different data sources? How do you present it really clearly? It's been a really exciting project to work on.
That's great. It sounds like a faster, perhaps more precise way to track diseases.
Yeah, it's amazing because they're able to create it's almost like the ancestry DNA of diseases of which two are really closely related, which could be related, but are probably more distant. And it really helps you map, especially when it's non-infectious diseases and you're not doing a person-to-person contact. It might be some bad lettuce. Well, how do you track who had bad lettuce? Genomic sequencing is a really great way to kind of put that puzzle together, especially in a county as large as King County.
Yeah, that really is disease detective work.
Disease detective.
Is that how you guys introduce yourself to people?
Very few people that I know of epidemiology. And so it's not only the easiest way to explain it, but it's also the name of our cohort group chat, Disease Detectives.
Oh, that's
what
cute.
We'd like to brand ourselves as.
That is fantastic. I love that. And it's important to note that the type of work you guys are doing doesn't just happen during the World Cup, but that public health epidemiologists do this monitoring every day to keep our communities safe. Why is this important work year round?
I think it just goes back to really protecting the public health of King County and Seattle residents and just really focusing on the fact that health should be a right for everyone and that everyone should be healthy as a baseline, and that public health work really helps to make that goal a reality.
And figuring out like what that baseline is. If you're not tracking this year round, then you don't know what is abnormal. One case might be abnormal in a specific population of a specific disease, but you don't know that if you're not doing this constantly. And so establishing what that baseline is really helpful and why this work is so important.
And I'd love to hear from you both. How did you each become interested in public health?
Oh, I grew up in Flint, Michigan, actually, and the water crisis was a big reason of why I got into public health. There's actually a very high number of people who grew up in Flint during that time who ended up going into environmental health. It's really interesting to look at, but that is the primary reason. I also think public health just really aligns with my values and my morals, and I don't feel like I have to compromise any of my politics to do public health work. And in fact, in a lot of ways, it actually aligns really well. And so that's something that's very important to me. I was lucky in that I wasn't directly affected by the water crisis. The water in my home was fine, but it is just disgusting the way that things played out and the way that the impacts were aggregated throughout the community. And it was very much focused, like the impacts very much were on the Black and brown people in Flint. And so, yeah, it's not great.
That helped launch you into a pretty great field.
It's true, but I'm one of many. Lots of work to be done still.
But that's cool that so many of your peers also said, hey, we need to go into this field because we've seen our community so severely impacted by this.
Yeah, it's very lovely. It's also very nice to know that there's a group of people who I think for the most part one day would like to go back and to be a part of making Flint really just a great community that cares for its residents and takes care of them. Flint has a history of leaving people behind and industry pulling out. And so it really kind of ties into a larger narrative, I think, about Michigan and the Midwest in general.
I think that really points to like what's so great about public health, or even like the people that make public health great, is there's a lot of care there. Like I can't imagine how you would go into this field and not care about people, not have like a personal pull to the communities that you are serving. And so that's just really great.
How about you, Maddie?
Fantastic question. I did not know that public health was a field that you could go into. I didn't know what epidemiology was. I was just a college student who loved a lot of different things. So I ended up graduating with a degree in applied mathematics, concentration in biochemistry, and then minors in sociology and leadership. But no one, not even me, really knew how that was all going to come together. I really loved numbers. I really loved the science stuff, but I did not want to sit in a lab. I did not want to sit at a chalkboard figuring out how to prove different theorems, as fun as that was. I really wanted to be working with people and impacting people. And it wasn't until my dad actually like, hey, I've been hearing about this epidemiology thing. It sounds like all of the things that you love. It's numbers, it's people, it's understanding stories and using them to create change. You should look into it. And I just went down this path of epidemiology. And the best part about the first year of this grad program so far is that it's proved me right, that there are all of these epidemiologists who are great at that data side, but are using it to create change, are using it to highlight stories that aren't often told, are using it to make more effective arguments to people in power, and are using it to love the communities that they're in. So it's been really sweet to see those different parts that I've always loved. I've always loved math. I've always loved people come together and go, okay, I can have a profession in this. This is going to be pretty epic.
And I'm curious, what do you most enjoy about the work you're currently doing with Public Health Seattle-King County?
I think what I'm really enjoying, honestly, is just talking to our coworkers who have been at Public Health Seattle-King County and just hearing what they have to say, listening to them, even just talking about the work, the type of language that they use. It's just really nice to be around people who really care about the work, are confident in the work, feel good about what they're doing. And it has been really nice, especially kind of going into the second year of our grad program, to just be around really positive people who really care about public health and are less bogged down by deadlines and school.
That's been such a gift to be a student in the workplace and to have the freedom to learn and ask what I think are the dumbest questions, but for that to be encouraged and celebrated and to become very keenly aware of how much I do not know, but for that to be the purpose of this experience, because you don't get this post-grad. If you're hired on to be a real life epidemiologist, you're going to have to figure this out. And so it's kind of like being an epidemiologist on training wheels, where it's okay to fall off and it's okay to make mistakes because you are supposed to be learning. And again, that's not an experience that you get through every master's program or that even every student in our programs here get. And so we are really lucky to have that experience.
Yeah, it's so nice to have that sort of safe space to learn and ask questions, but in a place where the learning is so applied and not just the classroom.
Yes, you're taking things that you're learning in meetings or training videos that you're watching, and you're directly putting them into practice later that shift. Pretty awesome.
And how do you think your experience on the SEAL team will inspire or influence the work you do after graduation?
I think I'm more interested than I expected in joining back up in the workforce and really trying to work in an epidemiology position specifically. I love environmental health, but I'm finding a lot of the methods that I'm using are very focused in epidemiology either way. And so I am really enjoying just those processes. And I think in practice in the field, I would actually enjoy an epi-focused position over an environmental health focused position. And that has been an interesting realization to come out of just my time in the internship.
I think for me, it's been a lot of the self-confidence of, we're getting dropped into the middle of a massive public health response for a really big event happening on the world stage here in King County. And yet, I'm able to go in and learn new things and adapt and learn new skills on the fly and put into practice things that I've been learning, and just the personal confidence and learning that, yeah, I am capable of that. And yeah, I can work with real life adults who have been doing this for much longer than I have. And I can hold my own and I can contribute in a positive way, has been really exciting, and taking that with me no matter where I go, whether it's to the workforce or whether it's continuing on through school. That's been really great.
Yeah, that's so true. It must be really exciting or motivating to see that you can already have an impact, especially at such a huge global event and keeping people safe, even though you haven't even graduated yet.
This internship, also just being World Cup related, is very cool. And it's very fun to be able to get into the global event vibes in the work setting as well as at home and in my personal life. So that's been really fun. It's also nice to be doing ICS for a big global event that is fun and focused on, people coming together versus the COVID-19 pandemic. So that's been a positive.
Yeah, does it make you guys watch the World Cup games differently?
100%. It's also, I don't know how all of our coworkers aren't hypochondriacs. Like when you're just hearing about all these people getting sick and who's sick where, I'm like, how do you go eat out at a restaurant like a normal person? But they do. And so I'm trying to remind myself to also not be a scaredy cat going out to eat.
Work-life balance. Rahma, do you see the games differently, or are you like, it's all good?
I think as much as it's scary, I love to be a part of the people, and being a part of the people has its risks. I love to be in a big crowd and eat all the food and things like that. And so as much as there are risks, it's also important to, have fun and live your life a little. And
like, what are you going to do? Turn down a Seattle dog?
Exactly. And I know that all of these public health practitioners and all of these processes are in place that are there to protect us. And so I'm going to trust them.
And now, if we do get sick, we know who will be calling us to interview us. And
exactly.
So what's better than that?
I'll be ready. I'll have all my information ready to go.
Fantastic. Every episode of Health Cascades, we end with a segment called Hope for Public Health. What is something in public health that is giving you reason to hope right now?
I love this question because it's actually what I've been asking to all of the real life public health professionals that I meet. And it's perfect because they are what give me hope. I think as a new public health professional coming in, I've only really known public health during turmoil and all this unease and questions about funding and what's next. And yet you still have people that are showing up every day, that are making this their life's work, dedicating their entire life to keeping people healthy and safe. And even in the midst of this turmoil, they have more of that long view of it's all going to be okay. It might be different. We might need to adjust. We might need to readjust again, but it's all going to be okay. And it's really inspiring to see people continue to show up even in that turmoil. And so I like to hold on to their hope that they have.
And Rahma, what is something in public health that is giving you reason to hope right now?
Before I started graduate school, I read this book called Health Communism by Beatrice Adler-Bolton and Artie Vierkant. And I think that book and just the principles and morals that public health embodies and the capacity for change that exists in public health, just generally on a large scale, really thinking about quality of life and just people living as healthy people is really something that gives me hope.
Thank you both so much for coming on Health Cascades. We really appreciate it. And thank you so much for protecting us all during the World Cup. Go USA.
Yay. Go soccer.
Thanks for listening to Health Cascades. If you'd like to learn more about the University of Washington's School of Public Health SEAL team, check out the links in our show notes.